Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Men of the Lagos State Police Command arrest 97 people for breaking the COVID-19 curfew and social gathering protocols in the Alimosho area of the state. Bayelsa State Water Transport puts measures in place to prevent the transmission of the coronavirus pandemic. And the U.S. says it will not be joining the WHO-backed coalition of 172 countries to share equitably any future vaccines against COVID-19. We begin in the Federal Capital Territory, the FCT, where 9 deaths have been reported of the 10 deaths recorded in the last 24 hours by the Nigeria Center for Disease Control. The center also reported 1 death in Delta State. The demographics of the confirmed cases have remained largely unchanged, with 64% male and 36% female. The country recorded 239 coronavirus cases last night in 14 states and the FCT. Community transmission is still ongoing, with 75% not knowing where they got the virus from. The number of active cases of COVID-19 in Nigeria stands at 11,214 after 372 people were discharged from 10 states and the Federal Capital Territory. Plateau State discharged the highest, 109, followed by Benue, 75, Bauchi, 52. Kano discharged 44 persons, 27 in Kaduna, the FCT 17, Rivers 14, 12 in Imo, 11 in Edo, 8 in Ogun, and 3 in Osun State. Apart from those discharged in Kaduna State, more updates from the government's Twitter account shows that only 11 samples tested positive out of 96 samples analyzed, and the new cases are 5 each from Kaduna North and Kaduna South and 1 from Chikun local government area. Now, from the Africa Center for Disease Control, 55 African Union member states are reporting COVID-19 cases. And when you look at the countries by region, you'll see that Central Africa has reported the lowest cases at 54,441. Eastern Africa is next with 100,350 cases, while West Africa has the third lowest figures at 161,380. Now, North Africa has over 200,000 cases. Southern Africa is recording the highest, over 600,000. The region has also recorded over 500,000 recoveries. Today, the continent's CDC is reminding us that surfaces are a breeding ground for COVID-19. So don't forget to disinfect your phones, tables, other surfaces at your home and work environment. And of course, don't forget to wash your hands. Coronavirus figures from the continent shows that over 1 million people have recovered from the virus on the continent, with over 30,000 deaths and almost 1.3 million cases confirmed. Now, the Lagos Police Command has arrested 97 suspected cultists for breaking the COVID-19 social gathering protocol. The suspects were arrested in a hotel in Miran in Alimosho local government area at about 2 a.m. while having what the police describe as a birthday party. Here's our correspondent, Ini John Mekwa, with more.
97 of them, young men and women who all appear to be under 35 age bracket, claim that the party, which started at 10 p.m., was to celebrate the 35th birthday of one of them.
It's just a mistake. I don't know that the party will be up to this.
Tell us, what is the meaning of this Maloka book arrests that you have?
I don't know the meaning at all. I don't know the meaning.
The police, however, suspects that the gathering was an initiation by a cult group. Recovered at the venue are exhibits which include 2 sacks containing broken calabash, dead chickens, and fishes.
So it's what they have as their own uniform. So, and equally, that day too, they are to celebrate their 15 years of existence. This is what they have here now. You've seen this one now. to brothers across Nigeria, Bucharest. So Bucharest, flotilla, 15 years of their forming their own organization. So cultists. And you've seen everybody, including all the sexes, both sexes, under the guise that they want to hold a birthday cake, a birthday party. This is COVID. You cannot be more than 20 at a place, and there is curfew in the night. All the hotels now have not been asked now to do full operation. So for them to have converged till around 1:30 a.m. in the morning, that was when the initiation was still going on now. The party was going on now when you got there. I got them arrested.
The hotel manager is also in the custody of the police. He claims that all he knows is that an individual booked for 10 rooms for the 28th of August.
We told them that if they want to do it at all, they will not be more than 30, but only one person that came then to book 10 rooms for, he said maybe there will be three in the room. So just 30 of them. Okay, then we said okay. But you can't be there for more than 2 hours or so. He said all precautions will be taken too.
The police say investigation is still on to ascertain the claim of some of the arrested persons who say they were just lodgers and not part of the party. Although the lockdown has been relaxed in Lagos State, there's still a curfew which begins at 10 p.m. and a prohibition of social gathering of persons more than 50. Ini John Mekwa, Channels Television News.
Now, worship centres in Delta State can now hold more than one service a day, but with strict adherence to COVID-19 prevention protocols. The Delta State government, through the state, made the announcement at a press briefing in Asaba, the state capital. Before now, churches and mosques were not allowed to hold more than one gathering in worship centres. According to the Commissioner for Information, Mr. Charles Anyago, now that restrictions have been eased, religious leaders must ensure that their members adhere strictly to the social distancing rule, wearing a face mask, washing of their hands, using hand sanitizers before worshippers are allowed into the premises. He also appealed to business owners who have been impacted by the lockdown to be patient with government, as the restrictions will be reviewed as soon as it is safe to do so. Meanwhile, more Deltans have joined the fight against victimization and stigmatization of COVID-19 survivors as they tell stories of their survival.
Before now, churches were only allowed to hold a single service. But now, we are going to allow worship centers to hold more than one service, but they must still adhere strictly to the social distancing rule, strictly to the wearing of face masks, and then of course the washing of hands or sanitizer, using of hands and alcohol-based hand sanitizer before worshippers are allowed into the premises of a such worship center.
When I got the news that I tested positive, I was shocked. I didn't know what to expect. I knew I wasn't going to die, but I didn't know what to expect and at some point I was like, is this even true? Is it real? Because when my result came out positive, I had no symptom. I had no symptom whatsoever. So I'm like, how is this possible? Not until I had a little bit of, it didn't last for like 2-3 days. It was just like a short while, a bit of sore throat. And then that was basically it. Yes, my case was mild, but still there are people that I know who had severe cases of, they experienced everything, that comes with the virus.
Let's talk some more about flattening the curve. Dr. Jagu Akolo is the Registrar Public Health Department, University of Abuja Teaching Hospital. He joins us from our Abuja studio. Thank you for joining us on the program.
You're welcome. Thank you for having me.
Have you read the guidelines the NCDC published on schools, the safety measures that they can take to keep COVID-19 at bay? Do you think that that guideline, that document is achievable?
Yes, I think those guidelines are actually achievable because it's basically to maintain and also sustain the necessary public health measures to curb the spread of the disease. If we actually follow strictly on those guidelines, I'm sure we will achieve great success. But however, it may actually be a little bit of concern in another way if you look at it critically, because at this point in time that the terminal classes have gone back to write WAEC and NECO and other exams. At this point in time, I expect that at the local government level, there should be a collaboration between the Ministry of Education and the Medical Officer of Health to visit most of these schools and ensure, assess the facilities they have, and also assess the number of students that are in each school, and then make a comparison and see if the numbers meet up with the infrastructures they have in those schools. If they don't, they should begin to consider reopening of the schools, having some students to go to school in the morning and others reporting to school in the afternoon. Because once the number of students outweigh the capacity of the infrastructure in the schools, then adherence to some of these public health measures will become very, very difficult. So in my opinion, I think the local government is key to investigating and monitoring to ensure that adherence is being achieved in that level. So it should be a joint collaboration between the Ministry of the Health Department at the local government level and the Education Department.
So
and also,
essentially,
they should visit
Dr.
those schools
Akolo,
and also create
a lot of stakeholders' involvement is needed here, but there are some who still disagree. The Lagos State, for example, announced tertiary institutions should resume, and perhaps more states will follow. But a group, for example, are saying that the attempt to reopen schools of some 4 million in higher education, some 10 million at the lower levels in this condition, they're saying it's a disaster waiting to happen, that colleges and universities are microcosms of the society with young people with a lot of zeal and energy. And these age group has been said to be some of the super spreaders of the disease, seeing as they usually appear, get COVID-19 mild to moderate or asymptomatic in terms of the symptoms.
Okay, yes, actually the guidelines are there. And the main issue is adherence to these guidelines. I think that is what we should be concerned about. If we don't adhere to these guidelines, then that is when we will consider it as a disaster. But if we approach it logically and these guidelines are followed strictly, then I think we may likely succeed when the schools finally reopens. The truth is that schools cannot be closed forever. It has to open. So we just need to do our part, government needs to do its part, and the citizens too also have a part to play to ensure that these guidelines are followed very strictly. It is very true that, you know, in the universities, you have people coming from different states, different caliber of people with zeal to explore and to do quite a lot of things. But I think when you engage these youth in discussion, if you engage these youth and you make them understand the implication of what they do can have a direct bearing even in their homes. Because eventually, if any one of them gets COVID-19, he will eventually take it home. And the parents who are elderly are more vulnerable, and it can be very devastating. So all we need to do is to inform these youth. So health education in this perspective is very key. So we need to health educate the students even as they resume back to school. We need to health educate them, let them understand what the COVID-19 and the implication of one individual in a classroom getting infected. That means you are closing the entire classroom, fumigating and all that, and in some instances, the entire school, university or higher institution may be shut down. So the implication is actually huge. So we just need to know what it is, and we just need to do the right thing. And then I'm sure we will be on the path to success or achieving COVID-19
Thank you
free
so
society.
much. A lot of optimism there. Dr. Jago Akolo, Registrar, Public Health Department, University of Abuja Teaching Hospital. Thank you for joining us on the program.
Thank you very much.
We have more on the COVID-19 update when we return. Please stay with us. Welcome back. Now, the fight to curb the spread of the coronavirus amongst transporters in Bayelsa State is not limited to those plying the roads, but there are those in charge of water transportation, and they say they're also complying with the Nigeria Center for Disease Control guidelines to curbing the spread of the pandemic. Here's an update with our correspondent, Dobra Timiwood.
Bayelsa State is 80% riverine, hence the major mode of transportation in the state to the hinterlands to most of the communities is via speedboats and canoes. We spoke with the chairman of the Boat Transport Association in the state on measures they've put in place to protect their passengers against the coronavirus, and here's what he said.
We have all the necessary equipment. We have the sanitizers. We have the face masks. Then we have all the necessary facility of the COVID-19. But because of the issue of the COVID-19, of the distant spacing, we carry 6 on the W19, while we carry 12 on the W23, which normally carry 24. We still maintain the same old transport fare. We don't increase transport fare. It is the same transport fare we are using, just to help the masses.
The number of confirmed cases for the coronavirus in Bayelsa State is almost at 400. As of today, there are 391 confirmed cases in the state and only 22 active cases. 3 persons were discharged, and the state has experienced only 21 deaths. From Yenagoa, Dobra Timiwood for COVID-19 updates.
Track, test and treat. Those are the 3 T's to controlling the virus. Joining us now via Skype is Mr. Idris Abdullahi. He's a lecturer, medical laboratory scientist and virology specialist, Department of Medical Laboratory Science, Ahmadu Bello University. Thank you for joining us on the program. I'd like to begin with the level we are with regards to testing and our targets. Are you comfortable with the further opening up of the economy?
Good evening. Thank you for having me. Well, indeed, keeping our schools closed a moment longer than absolutely necessary is socially intolerable and economically unsustainable. However, there are concerns about whether sufficient coronavirus infection prevention measures are in place. Some government policymakers in developed countries suggested getting pupils, students, and teachers, that is for high schools and primary schools, or lecturers in the university, tested every week, as much as every week, if they do not, even though they do not have any symptom for the COVID-19. Well, for me, I believe testing of students and their teachers is necessary ahead of opening of school. When you look at the total number of people tested so far in Nigeria, you realize that barely above 400,000 people have been tested. I think it's still insufficient. Considering so many agitations by student unions and even some state governments of reopening these schools, I believe these students and their teachers need to be tested before they actually get into the schools. Even though we know that most of the students and pupils are not hardly hit by the severe form of COVID-19, that is based on available epidemiological data, the risks of children coming down with severe COVID-19 is very low. However, we have to put in our mind that some students or pupils might have comorbidities that could actually facilitate progression to severe COVID-19. And as such, we really need to be very careful. Testing needs to be focused on...
Mr. Abdullahi, because we remember the PTF earlier in August said that it wasn't compulsory to test schools as they resume, but essentially adhering to the non-pharmaceutical measures and essentially behavioral change.
Well, for me, I think that wouldn't be sufficient because there is no way you can actually know whether someone is harboring or carrying these viruses by just mere physical appearance, because these viruses actually cause asymptomatic infection in majority of population. So for me, I think testing needs to focus on massively increasing the number of people tested, especially using fast and inexpensive screening tests that could identify asymptomatic people that carry these viruses before they actually present for themselves to the schools. I think it's necessary for me.
All right.
And I think one of the reasons why
Go ahead, quickly, please.
I think one of the reasons why the PTF is taking that dimension is considering the economical implications of this test. However, we really need to consider that there are some equipment like the gene expert machine that are relatively cheaper to run and even less technical than the conventional PCR workstation. If that still cannot be affordable for government, I think we could actually consider delving into fabrication of these point-of-care serological assays. Although I'm aware that Medical Laboratory Science Council of Nigeria evaluated some of these products some time ago, of which none of them passed proficiency testing. That still is insufficient. I think we really need to evaluate more of these products and even delve into producing the product ourselves in Nigeria, locally made, so that we make use of local strengths in producing these products. With that, we can actually have products that can provide better diagnostic performance than the ones that we might consider importing from abroad.
We look forward to the PTF briefing tomorrow. Thank you so much, Mr. Idris Abdullahi, lecturer, medical laboratory scientist and virology specialist. Thank you for joining us on the program.
Thank you.
Now, the United States says it will not be joining the WHO-backed coalition of 172 countries to share equitably any future vaccines against COVID-19. President Trump says the U.S. instead will continue to engage international partners to ensuring the U.S. defeats the virus. Meanwhile, around the world, efforts continue to keep infection rates down. Here's more on global updates.
President Donald Trump's insistence on not joining the WHO initiative comes as the country passed the 6 million mark on the number of coronavirus cases, with experts criticizing the government for its weak response to the pandemic, which has claimed nearly 185,000 citizens.
Compare the United States with China. When we have 50,000 people a day infected, which we have 45 to 50,000 every day over the last month, they have 10 to 15 people infected. When we have 1,200 people die a day, they have none die a day.
In the UK, Prime Minister Boris Johnson's leadership during the pandemic has also been criticised, especially from the opposition Labour Party.
Even his own MPs have run out of patience. The Vice Chair of the 22 Committee, the MP for Broxbourne, has said the government says one thing on Monday, changes its mind on Tuesday, something different is presented on Wednesday. That sounds familiar, doesn't it?
South Korea is seeing a surge in the number of patients critically ill with COVID-19, most of them aged over 60. As at midnight today, 124 patients were in serious or critical condition with COVID-19. There was a rise of 20 cases from the previous day and a marked increase from the 9 cases on August the 18th. And in Italy, Pope Francis held his first weekly general audience with a live crowd in 6 months as the Holy See slowly lifts restrictions imposed due to the coronavirus pandemic. About 500 people attended the event held in the San Damaso courtyard in the Vatican's Apostolic Palace, nearly all of them wearing masks and keeping social distancing except for when the Pope walked near them. Finally, in China, head of the Center for Disease Control and Prevention, Gao Fu, says there is no evidence that the mutation of the novel coronavirus
will affect the COVID-19 vaccines under development. He also noted that since the winter flu season is coming, the situation will become complicated because the flu may mix with the COVID-19 to threaten people's health. He suggests people receive flu vaccination first before a safe and effective COVID-19 vaccine with good quality control becomes available.
Take a look at our website, channelstv.com. It has more updates on the pandemic. You'll see 3 PSG players testing positive for COVID-19 and several other stories. That's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.